Basic information about diabetes. Diabetes is a chronic disease characterized by impaired blood glucose levels, which arises from insufficient insulin production by the pancreas or from ineffective use of insulin by the body. Insulin is a hormone that regulates blood sugar levels, and its deficiency or resistance leads to hyperglycemia, elevated glucose levels, which can cause serious conditions including cardiovascular diseases, nerve damage, and organ complications. Types of diabetes. Type 1 diabetes. This is an autoimmune disease where the immune system attacks and destroys the beta cells of the pancreas that are responsible for insulin production. It usually develops in childhood or adolescence and requires constant insulin therapy. Type 2 diabetes. This is the most common form of the disease, occurring when the body cannot effectively use insulin. It is often associated with obesity and a sedentary lifestyle. Treatment may include changes in diet, physical activity, and medication. Gestational diabetes. This develops during pregnancy and can negatively impact both the health of the mother and the fetus. It typically resolves after childbirth, but increases the risk of developing type 2 diabetes later in life. Risk and symptoms of diabetes. Common symptoms of diabetes include increased thirst, frequent urination, fatigue, weight loss, especially in type 1 diabetes, blurred vision. These symptoms may develop depending on the type of diabetes and the stage of the disease. Prevention and diagnosis. Prevention of type 2 diabetes includes maintaining a healthy weight, regular physical activity, and a balanced diet. Early detection of the disease is possible through regular medical checkups and blood glucose tests. Main diagnostic methods: fasting blood glucose test, oral glucose tolerance test, HbA1c, glycated hemoglobin, test. Knowing the risk factors and symptoms can help with early diagnosis and treatment of the disease. Diabetes treatment methods. The treatment of diabetes aims to control blood glucose levels and prevent complications. Approaches to treatment may differ depending on the type of diabetes. Type 1 diabetes. Patients with type 1 diabetes require daily insulin therapy, including insulin injections and the use of insulin pumps to better control blood sugar levels. Oral hypoglycemic drugs may also be added. Type 2 diabetes. Treatment of type 2 diabetes includes diet and physical activity, a balanced diet with restrictions and regular physical activity. Medications, drugs to increase insulin sensitivity and slow glucose absorption. Insulin therapy. In cases where lifestyle changes are insufficient, insulin therapy may be required. Gestational diabetes. Treatment of gestational diabetes typically includes a restricted diet, and if ineffective, insulin therapy may be required to control blood sugar levels. Bioresonance therapy, BRT, in diabetes treatment. Bioresonance therapy, BRT, is an alternative approach that is used as an adjunctive treatment for diabetes. This technique is based on the use of electromagnetic waves to correct disturbances in the body. The application of BRT in the management of diabetes includes the following aspects. Blood glucose control. BRT may be used to improve cell sensitivity to insulin, particularly in type 2 diabetes. This is achieved through the modulation of molecular mechanisms involved in metabolism. Reduction of inflammation. Chronic inflammation is often present in diabetic patients and can worsen the disease. BRT may help reduce inflammatory responses, supporting normal metabolic function. Improvement of overall well-being. BRT is used to improve the general well-being of patients, reducing fatigue and stress, which helps enhance the quality of life for those living with a chronic condition like diabetes. Combined treatment with insulin therapy. In some clinics, BRT is combined with traditional diabetes treatments to enhance the body's response to insulin and reduce the required insulin dosage. Regular blood glucose monitoring. Regular blood glucose monitoring is important for all types of diabetes. It is recommended to measure blood sugar levels 2 to 3 times a day to avoid hypoglycemia and other serious complications. Prevention of complications. The main goal of diabetes treatment is to prevent late-stage complications such as cardiovascular diseases, nerve damage, and kidney problems. This is achieved by maintaining normal blood glucose levels, controlling blood pressure and cholesterol levels, regular medical checkups. Conclusion. Thus, effective management of diabetes requires a comprehensive approach, including lifestyle changes, medication, bioresonance therapy, and continuous monitoring of health status.